Psychodermatology is, as the name suggests, it is the intersection between mind and skin. Right? Both of them carry a lot of stigma, specifically when we talk to Indian culture. Both skin conditions and mental health conditions. Almost all skin conditions are influenced by stress. There are so many things that skin conditions can affect the mental health. If you can say, like, just simple, you take example of acne or pimples that teenagers get and how stressed they become. During this whole journey, my main inclination was toward approaching dermatology with a lens that covers all the aspects of life, not only clinical ones. That was the aim that led me to pursue the field of psychodermatology, which is very emerging. Apart from all this, like all these academic activities, I am a musician. I have a professional band, and we perform at various events professionally. And I also compose songs related to mental health. So yeah, this is something that the various aspects of my life and my career. Spreading awareness about mental health is something that is very close to my heart, and music is something I feel is a medium that can reach to each and everyone without any barriers.
The Gen Z or the coming up generation, Gen Alpha, they believe in like you should have, two jobs or, double income and all that, which is good. But at the same time, how do you balance? Like you are doing two different things. There's your band and then there's your medical profession. So how do you balance that and plus your personal life?
In hypnosis, you are doing all the hypnosis. I am just guiding you to the state of trance, and it is your mind that is always going to be in control. But yeah, main thing is that it is all hypnosis is self-hypnosis. It is you who are doing that. I'm just there to guide you through the process of it.
I just wanted to know one thing. Do men also come for psychodermatology?
Yes, but there are a lot of resistance we feel in men related to when it comes to mental health.
Yes, that mental health is incomplete without MEN, men with it.
Sometimes they don't know that the real problem lies inside their mind and not on their skin.
Oh please, Pritika. Well, you can call it OP square. Hello everyone, welcome to Oh Please Pritika. And today we have a guest. And it's very interesting because this is the first time we are having a man on our podcast. And I always say mental health is incomplete with MEN in it. So I would like Ishan, as he has done so much in this field, to introduce himself and give us information about what he has achieved in his career and what is he doing currently. Ishan, my viewers would like to know more about you. So over to you.
Yes. So hello all. I am Dr. Ishan Pandya, and I am basically a dermatologist. And I did my MBBS and MD. After that, due to just pure interest, I did MSc in psychology, masters in psychology. And during this whole journey, my main inclination was toward approaching dermatology with a lens that covers all the aspects of life, not only clinical ones. So that was the aim that led me to pursue the field of psychodermatology, which is very emerging but also very useful and very important field in terms of when we say the newer approaches of mind body medicine that is coming up in the era of medicine. So that is something that is my main field, and along with that, in the field of psychodermatology and individually dermatology and psychology, I frequently use hypnotherapy and music therapy also, because that is again something that I am very close to. Apart from all this, like all these academic activities, I am a musician. I have a professional band, and we very perform at various events professionally. And I also compose songs related to mental health. So yeah, this is something that the various aspects of my life and my career.
Wow, that's great. And psychodermatology is an emerging field. Many people don't know about it. So I think with this podcast, people will be aware of it. And it's very important because in every field, psychology is important.
Yes.
Yeah. So, how do you integrate your knowledge of dermatology and psychology in your practice, particularly in psychodermatology?
Okay, so very interesting question, because if we want to understand how I integrate psychodermatology, the first thing is to understand what psychodermatology is, right? So psychodermatology is, as the name suggests, it is the intersection between mind and skin, right?
Mhm.
So even though, like, I feel this is one of the the most of the paradoxes or the similarities between mind and skin. Like, one is the most visible organ of the body, while the other doesn't show any signs. Like, people don't know what's going on, and while the skin is something that everyone knows what is going on with your skin, right? And the other similarity is, this is the paradox, and the similarity is both of them carry a lot of stigma, specifically when we talk to Indian culture,
Mm, mm,
both skin conditions and mental health conditions.
yeah.
So when we see both of them together, it carries a lot of burden for the patients of
Mhm,
skin conditions.
mm,
And if we see embryologically, when our organs develop from tiny cells, the skin and the brain, they both develop from the same set of cells. So that is how also they are very much connected right from the embryonic stage.
okay.
So from this, psychodermatology arises in the sense that there are so many things that skin conditions can affect the mental health. If you can say, like, just simple, you take example of acne or pimples that teenagers get, and how stressed they become.
Correct.
And what we see is just the tip of the iceberg in general
Mhm,
population, that okay, the person is stressed, but many times it leads to very severe depression, very severe social isolations,
okay.
and even up to suicides also.
Mm,
So it is something that needs to be addressed, not only just the skin condition, but also the mental health condition, and
mhm,
vice versa, when almost all skin conditions are influenced by stress,
okay. Okay.
and
Okay.
many of them are purely triggered by stress, or stress have a very major role to play in it.
Okay. Okay.
Yeah.
Yeah, like I always say, everything starts from stress. Stress is the foundation for everything.
Yes, yes,
Yeah. So this is a great information because many of us, they think that mental health doesn't affect our skin or our body. But yes, that is why it's important to do self-care, to take care of ourselves. It's very
yes,
important.
yes.
Yeah. So, what role does hypnosis play in your treatment approach, and how do you find it beneficial for your patients?
Very, very interesting question. Look, hypnotherapy is something that majorly works on your subconscious mind.
Hmm.
Like, there are so many myths around hypnotherapy in general population. You also might be knowing it,
Yes.
but in fact, it is one of the very useful modalities in any field of medicine, not only dermatology. Because since, if we see our subconscious mind, or just plainly our mind
Hmm.
has so many capabilities of changing the physiology of the body also, up to a
Mhm.
certain extent. Because I say up to a certain extent, because hypnotherapy is not a solution for everything,
Yeah.
right?
Yeah.
There are certain conditions, or it has certain limits up to which
Okay.
it can act. So yeah, up to certain extent it can make changes in your physiology of the body.
Hmm.
So when it comes to dermatology, the first and foremost thing, or very basic thing, that hypnotherapy does is relaxing the body, and thereby reducing the stress. So how it affects is, by decreasing the stress, it decreases the intensity of the skin condition that is already there.
Mm-hmm.
It improves the benefits of the medications that we are giving for the patient.
Okay.
So if a patient is not responding to certain medications, or the response is lower than what we are expecting as physician, and somehow, like, patient is not accepting, or he is not aware of,
Mm-hmm.
he's stressed, but there are underlying stressors that is involved.
Correct. Correct.
So in those conditions, hypnotherapy works very well by reducing the covert stress.
Hmm.
Then we can target very specific conditions via hypnotherapy. Like specifically, there are studies involving few conditions in dermatology. When we say about viral warts, which is a viral infection of skin, where we get tiny swellings over face or any parts of the body.
Hmm.
In that case, it is mainly related to infection and a little bit decreased immunity of the body. So hypnotherapy helps in increasing the immunity of the
Hmm.
body and directly targeting the infection.
Okay.
And then in all the other condition, if we know the underlying mechanism of why this condition is happening, hypnotherapy can help in regulating those conditions.
Okay. Okay, that's great. That's great information. So you also spoke about your music band which you perform, and your songs revolve around mental health. So can you share with us what inspired you to use music as a medium to address mental health issues?
Yes. So again, music is something that has a lot of effects on mind and body again, and we all are innately connected to music right from our birth, or even when we are in the womb of our mother's body.
Yes.
So music is something we all can relate to, so it's kind of universal language.
Mm.
And that is something I'm always very much passionate about, spreading awareness about mental health, because I see how people around me or my patients are suffering from mental health. And the uh, most frustrating part for me is to know that how they cannot share it with anybody because they fear about they will be judged or they will be called weak. So spreading awareness about mental health is something that is very close to my heart, and music is something I feel is a medium that can reach to each and everyone
Yeah.
without any barriers.
Correct, correct. That's right. So, as like the Gen Z or the coming up generation, Gen Alpha, they believe in like you should have, two jobs or double income and all that, which is good. But at the same time, how do you balance? Like you are doing two different things. There's your band, and then there's your medical profession. So how do you balance that, and plus your personal life?
Yes, first of all, you need a lot of support to do that
Hmm.
from your family, from your wife,
Yeah.
and
Correct.
all of them, right?
Yeah.
Without them, this juggling between all this is not possible. For Gen Z, like you have to create certain boundaries for that up to where your professional work is there and when your passion starts. And
Hmm.
it varies for everyone. Like everyone has different responsibilities, different necessities. Like someone who is earning to get food, two times food, they cannot, like, it is not possible for them to pursue their hobbies because the primary needs are not met in their lives, right? So again, I feel that I'm blessed regarding that part, that and it also helps me pursuing what I like. So again, it is about distinct having a clean distinction between your professional and your passion. So that is something that everyone can do. It is just about uh, realizing the right balance between these things. Like for me, uh, I shut my OPD off for my dermatology and psychology patients at around 7:30 p.m. And then post that I do all this music
Okay.
and all. Yes.
Okay. That's great. That's good information. So, for someone new to the field of psychodermatology, what would be your advice on how to get started and what to focus on?
First of all, uh, for a psychodermatology, practicing psychodermatology, you need to
Mm-hmm.
have a primary field.
Mm-hmm.
Uh, you need to have proficiency in either psychiatry, psychology, or dermatology. Make either of one, whatever is your primary field. It is not advised ki you practice everything, a little bit of everything. So it is important that you master one field,
Mm-hmm.
okay, and then you swim into the waters of psychodermatology. So as a dermatology, I my primary field is dermatology as psychodermatologist, and then I inculcate the concepts of psychology and psychiatry and various treatment approaches. But
Mhm.
again, there come certain limits for me as psychologist because I'm not as much trained in psychology as in dermatology.
Yeah.
So I often refer my patients to psychiatrists and psychologists. So
Okay.
if you are a psychologist or a mental health professional, it is important that you master your first profession first, and then you gain some knowledge about dermatological aspects or dermatological disorders so that
Mm-hmm.
you can practice psychodermatology. Because
Okay.
as such, there are no recognized degrees for psychodermatology as of now. There are few fellowships or few diplomas that are going on from international associations and from the national associations also. But it is mainly about your practice and about your passion to practice this field.
Yeah, yeah, yeah. So, what do you think about this field? Like, is this going to evolve in the next few years in our country? As you know, psychology itself is on the nascent stage. It's just like an on first stage. So, what about psychodermatology? As this is a different field.
Yes. So as you said, the psychology is at the nascent stage. This is below that.
Okay.
It is still emerging. Like people know about psychology. People don't have
Yep.
any knowledge about psychodermatology. But the fact that it is going to evolve in few coming years because it will evolve along with the mental health awareness,
Hmm. Hmm.
along with psychology,
Right.
right? And the fact that there are so many the same factors that contribute to psychology and the constant comparison, the constant judgment people are having, social media, and all those things, it is going to create uh, like psychodermatology is going to play a huge part in that.
Mm-hmm.
Also, one of the things that may limit psychodermatology is the, or something that I would like to see is that it is given importance by other health professionals also, not only psychodermatology, but the integration of mind body medicine as a whole. Because again, because the financial reward is much lesser than what you expect from the efforts you put in. So that is also again something that should be looked upon in future.
Hmm. Yeah. Okay. That's great information. So, what do you believe is the most significant misconception as you spoke about hypnosis, and how do you address it with patients?
Okay, very interesting question. Because there are so many misconceptions about hypnosis. The most being like you will get control over our mind.
Okay. Mm-hmm.
So it is something that that is because of the how we see hypnosis in pop culture or in movies or in series. So for that, I tell my patients that in hypnosis, you are doing all the hypnosis. I am just guiding you to the state of trance, and it is your mind that is always going to be in control. I am not, of course, I'll say that I'm not in control of what you are doing, but it is your mind. If your mind is not ready to do something, you will not do it. It
Correct.
is as simple as that. But
Correct.
yeah, main thing is that it is all hypnosis is self hypnosis.
Hmm.
That it is you who are doing that. I'm just there to guide you through the process of it.
Hmm. 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 That's great. So, how do you measure the effectiveness of hypnosis in your treatment outcomes? And what tools or methods do you use to assess its impact?
Uh, First and foremost is the subjective aspect, like
Hmm.
asking patients how they felt immediately after hypnosis and after few sessions I give them. And the most important
Yeah.
aspect in dermatology is seeing how their disease is recovering and how the medications are taking their effects. Because when we talk about psychodermatology and hypnosis, uh, when a patient is undergoing stress, the disease is not responding properly to the medications like we
Hmm.
expect.
Hmm.
Suppose a disease, for something we start a medication and we expect certain results after 1 month or after 15 days to 1 month, but we are not getting, our patient is still getting some kind of flare-ups or episodes. Then
Hmm.
we dig deeper into their psyche,
Hmm.
or and try to identify if there are stressors or what is going on in their lives.
Hmm.
And sometimes we find something, sometimes we don't, because even patients are not aware of what's going on. Then when we do hypnosis and relaxation occurs and patient, it is also important for patients to practice the
Correct.
hypnosis by themselves also. So when they uh, use hypnosis, and after a certain days or certain period when they come and we assess the condition, then we can see the difference in the improvement that they are getting. And also in chronic conditions for which the patient has taken so many medications and still there are so many recurrences or relapses that is happening, even in those conditions hypnosis can help in maintaining the remission of
Hmm.
the disease. So this is how, there are no, I mean there are measures by which we can assess, but clinically it is not very practical to do all these things in a busy OPD. The most common being you can use blood pressure or heart rate or pulse rate and things like that, that is very handy before
Okay.
and after the
Okay.
session.
Okay. Yeah, that's great information. So, what role do you think music therapy can play in mental health as things go forward? Because music is one thing where people want to know how it works, and people are doing a lot, in this field. So, as it's getting involved, and India is a country where there is a lot of music. Our movies have music, everything has music. So, what do you think it's going to play a role?
Very interesting, because music has so many effects on our brain. One of the main effects that we all know is stress reduction. Like people use it as a coping mechanism, which is one of the most
Hmm.
majorly used but very underrated use of music, because people say that I use music as a coping mechanism or when I am stressed, but they don't see it as a primary coping mechanism of their lives, because it can be, right? Because it has the ability to secrete dopamine and secrete endorphins in their system. So, of course, stress buster is something that music does. Then listening to particular uh, particular music or particular tempo or tone and timbre, all these things, what kind of music we are listening to, can have effects on our body's regulation, body's physiology. Like listening to soft slow relaxing music can relax your body and decrease the stress levels and cortisol levels. Again, it comes under the relaxation procedures when we do along with music. Then the music activates almost all parts of the brain. So it activates your prefrontal cortex, the hippocampus, the amygdala for the emotions, and even motor and sensory cortex also when we listen to
Correct.
music.
Correct.
So many a times, not particularly to mental health, but in patients with neurorehabilitation or patients or children with on neurodivergent spectrum, in those population, the music therapy has a huge role to play.
Okay.
When specifically coming to mental health, it can, of course, anxiety reduction can is a very important aspect. In patients with depression, like in music therapy, we have certain techniques, certain methods in which there are some verbal discussions we do,
Hmm.
specifically pertaining to one specific song the patient is most attached to. And when we discuss about what they like about the song, what kind of lyrics
Hmm.
they like about them, it helps change their perception towards life, discussing those uh, events or discussing those lyrics. Then it has a important role in catharsis also,
Yeah. Yeah.
from in mental health.
Hmm.
And in patients with dementia, patients with memory loss, music therapy can uh, can invoke certain memories or certain memory. It can activate certain memory centers. So it helps in those cases also.
Okay. Okay. Yeah. That's a great way. Like music is really therapeutic. It does help a lot. But on the next thing that, as you do hypnosis and psychodermatology, so have you come across, times where patients have resisted? And what are the common complaints or conditions that come to you?
Okay. Uh, first rule of like practicing psychodermatology is that the patients are primarily coming for their dermatological
Hmm.
concerns. For me, as a dermatologist, they are
Hmm.
primarily coming for the skin condition, right? So first of all, my duty or my job is to assess their skin and give them satisfactory answers or satisfactory explanations about their skin conditions. And only after doing that, I can delve into the psychological part of it because that's what the patients expect from me.
Correct.
So after that, it is very much like we do in counseling. The therapeutic relationship matters the
Yes.
most
Yes.
rather than the treatment that we
Yeah.
choose.
Yeah.
So building rapport is something that is first and foremost. If
Yeah.
I find that in the first consultation, the patient is still anxious, not comfortable with me, even resisting or not answering questions pertaining to dermatological history, I don't ask about psychological history in the first
Mm-hmm.
consultation.
Correct.
Only until and unless the patients get comfortable with me and they are open to uh, exploring more, only then I go into the psychological aspect of history taking.
Okay. Yeah.
And by very subtle questions like asking about their sleep, asking about their appetite,
Mm.
and where do they work, how their job is. So it's very subtly I redirect the
Mm.
whole question answers to the psychological aspect so
Mm.
that they don't get very abrupt change in the uh,
Correct.
answering the questions.
Mm.
And by this way I can decrease the resistance that they are showing.
Yeah. Yeah.
Yeah.
Okay, that's a great way of doing it. So, looking ahead, what are some of the projects or initiatives that you want to do, or you're looking forward to, going to do?
So many things I would like to do for this thing, but again, there are very limitations with the with only
Mm.
24 hours of the day. So uh, first and foremost thing, the awareness about the psychodermatology, specifically not only in general population but among the professionals also, among dermatological professionals. And I preach not only psychodermatology but mind body medicine as a whole concept. So I would like that each and every physician or each and every medical professional become aware of how mind can affect the body and don't not to neglect the effects of psyche on the conditions,
Yeah,
not only skin but all the conditions that are there.
yeah.
uh, Second, I would like to like spread awareness about psychodermatology as a whole because many people suffer because they don't know that stress is causing all these things. And while they are applying various kind of sunscreens and all kind of serums and moisturizers, sometimes they don't know that the real problem lies inside their mind and not on their skin.
Okay, okay. Yeah,
So it helps a lot of people just to realize that okay, this is where the things are not right, and uh, I'm targeting a different thing than
mm,
what I should be targeting.
mm.
So psychodermatology plays that role also. I would like to conduct the researches on all this, but again, it's about the if time permits,
Yeah, yeah,
because it's a very interesting thing to do, and
yeah.
only people will only believe if there is an evidence or there is research regarding this.
Correct, correct, right. That's great. So with this, we go to the next segment. That's a short one. It's a rapid fire round so that people know more about you or your likings. Okay.
Yes.
So, If you have to choose between hypnosis and music, what would you choose?
I actually use both.
Okay, so
I use
yeah, you can answer both. No problem.
yes.
Okay, what about dermatology and psychology? What would you choose there?
For all the practical aspects, I would say dermatology.
Okay, okay, okay. So when it comes to clients, who is the most easier to deal with, like adults or children?
Adults
Okay,
for me.
okay, that's great. Okay, yeah. Everybody has different, right? That's fine. So, what did you prefer, your student life or your adult life?
Hmm. I think everyone will agree with student life.
Yeah, sure. The responsibilities are less compared to the adult life.
Yes, yes.
Yeah. So, this is, I mean, really nicely answered. I just wanted to know one thing. Do men also come for psychodermatology?
Yes, but there are a lot of resistance we feel in men
Yeah.
related to when it comes to mental health,
Yes.
and they mainly come for clinical dermatology concern, like for something that is causing them issues with skin,
Correct. Yeah.
and not for their routine care,
Yeah.
skin care, as frequently as females do.
Yeah. Yeah.
So that is something that I would also like to preach upon, that skincare is for everyone. It's
Yes.
not only for females. Same goes with the mental health, that
Yeah.
it is
Yeah.
also for everyone.
Yes. Yes.
But it
Yeah,
is
that's what
yes,
I told in my previous podcast also, that mental health is incomplete without MEN, men with it. So
yes, yes,
men also play an important role. And thank you for shedding that light, that mental health or even skincare, it's for everybody.
yes.
Yeah. So with the rapid fire getting over, I have a thing that, do you have any question for me?
What do you feel about psychodermatology?
Actually, I, from a young age, I mean, it would be maybe in my 20s, I started getting pimples.
Hmm.
And then it was like, why do I get pimples? What is the reason for that? So then when I did my, the doctor said to do the full, they say, right, X-rays and, to find
Yes.
out. It came out that it was PCOD, because of PCOD.
Hmm.
Uh, the doctors that time told me PCOD is genetics. I agree, it is genetics. But I feel also because of the stress that I take, I am an overthinker. So because of that, because genetics can play a role, but how we treat things or how we handle things, that also plays an important role. So today I came to know my mind is, I think, 80% on because of that, and 20% is the genetic part. And which I've heard also many a times, that 80% what we do can create the problems in our life rather than the 20%. So today you shed the light on it. So now I think I need to take care of my mind and my skin more also. That's important.
Yes, yes. It's like we learn in psychology or mental health the biopsychosocial model of
Yes,
the
yes,
disease. Like
yes,
when each of the factors come together, then only a disease happens.
yes, yes,
It's
correct.
not only just genetic part, but it
Yeah,
also
yeah,
all the factors also
yeah,
play a major role in the
correct.
development of it.
Even if it's 50%, the other 50% can be handled by us. But if we don't handle it, it'll become 100% for sure.
Yes, yes.
Yeah.
You know, one of the most bizarre things that I recently found out about this psycho or skin and mind. I was reading a book by someone, I don't remember which book, but there are evidences that our mind and skin are similarly sensitive. Like
Correct.
if you ask people with sensitive skin, they'll be also very much sensitive by their mind also. So they will get easily triggered with some kind of situations or very minor situations or events. And similarly, their skin is also very sensitive. So this is something I now routinely ask patients if they come with some sensitive skin or
Yeah,
very
yeah,
rashes. This is something that I ask them.
I can relate to this because my skin is sensitive, and from childhood I am trying to work on it, but from childhood I'm very sensitive to things also. So I can understand that part. So yeah, that's why I probably also get pimples quite faster, and
Right.
yeah. Yeah. So it was great talking with you, Dr. Ishan, and it's a lot of information, and I'm sure the viewers also would get a lot. And in case you all want to get in contact with Dr. Ishan, we will be putting his Instagram handle over there. You all can reach out to him, and he will be there to answer your questions. You all can also leave your questions on the comments so that we can send it to him. And don't forget to like, share, and subscribe. And also, we will come very soon with a new guest from a different walk of life. Uh, do you want to say something, Dr. Ishan?
In the end, I would just like to say that take care of your skin and mind both, not only either of them, and seek help whenever you need it, because it's available everywhere, wherever you can find.
Yeah.
Seek help. That's the only thing I would like to say.
Yeah. That's a great message. Thank you once again. And yeah,
Thank
all
you.
the best for your new ventures or what the initiatives that you're doing.
Thank you so much. Thank you so much for having me here.